Welcome to all of you. Great to see nice young participants attending a unique conference out here. I welcome all the dignitaries on the dais, experts in their own fields, and really appreciate Santosh and Krishna Raya. So for taking the initiative to start a conference like this. We at Sushena, if you know, we've been at the forefront of human milk banking, and which is pretty much where nutrition starts for a baby in our life cycle. So we're very keen to work further in this area and see how this goes forward. Yeah. Thank you for attending the conference. Yeah.
So, good morning, everyone. Dhaatri Devo Bhava, Tirtha Devo Bhava, Acharya Devo Bhava, Dhaatri Devo Bhava. I pay my respects to everyone and everything. I would like to start off with a small apology. You have been very patient with the chaos in how the conference has started, but I want all of us to recognize that we are partaking in creating history. So this is South Asia's first NurtureCon, and me being from a non-healthcare background, I am proud to say that just as a student of Santoshi and so many of our Dr. Govind sir, so many of our brilliant speakers here. As a non-healthcare background person, I am able to appreciate the value of mother and child nutrition more deeply than ever. You may think, why are we even specifically focused on child nutrition? And there may be also a sentimental value attached to it, thinking that, okay, mother and child means, it is good to focus on that. But, in this very happily female majority audience, I would like to congratulate that, firstly the organizing team for that. And let us appreciate the fact that we are surrounded by mothers and we are all children of our mothers. And so building mother and child nutrition is nothing but part of nation building. And as a humble company called Millgro, we are proudly partnered with Sushena Health Foundation. And through the course of this conference, we will help you understand a bit more of what our vision is. And we again warmly welcome you to NurtureCon and request your cooperation and enthusiasm in this process. Thank you so much.
So the first session is maternal nutrition, cornerstone for future of this world. Yes, it is rightly captured that it is a cornerstone for the life, right? So this session is honored by Professor Subos sir. So over to you, sir.
Sorry for that. I request Professor Subos to deliver the inaugural address.
Good morning, all of you. Can you hear me at the back? Okay. So, respected dignitaries on and off the dais, thank you, Sushena Foundation, for giving us this opportunity to be part of a very important conference on NurtureCon. Friends, I think nutrition is a subject which requires more attention. I think healthcare is getting attention, but I think nutrition requires more. You all, I'm sure, are familiar with our MDG goals, the SDG goals, and you will be surprised that in the MDG goals, although there were 3 goals on healthcare, there was not a single goal on nutrition. but I think the world has recognized the importance of nutrition in the SDG goals. I think the goal 2 and goal 3 are nutrition and health. So now we know that nutrition and health goes hand in hand. So that's the first takeaway. I think there is some recognition, but it's a long way to go. We also have very, very interesting statistics. I don't know, many of you are from Telangana. I'm happy that I had the opportunity to work with Dr. Kathy with UNICEF. A couple of the projects we have done, and even at that time, we came to know the staggering statistics. 50% of pregnant women in Telangana were anemic. That's one indicator which has been increasing. I think if you look at the National Family Health Survey, 4th, 5th, 6th rounds, the only indicator in our country which is increasing over a period of time. We have been very, proudly saying our IMR is coming down, MMR is coming down, but malnourishment is something which is actually going up. Your hunger index actually, in terms of ranking across the world, we are not doing very well. So there is a lot of work to be done. The number of children who are in stunting, the percentage is still very high. 33% is what we come to know. So there is a lot of emphasis on malnutrition because it has a direct impact. It's a lifelong disease. So one of the projects we did with UNICEF again, where we're doing a universal screening. So we all think that malnourishment will be for pregnant women. No, at the school children, I ask my own staff, how many of you are anemic? I find that 50% of them are anemic. So it's a sort of a problem which has to be addressed, because once you go to the schools, you go to residential schools, 8th standard, 9th standard, because of lack of anemia, they are not able to perform well. So you look at the productivity loss. So as an economist, we always look at the long-term impact. There is a healthcare expense loss, there is a productivity loss, where human capital comes down. Whereas the reverse is also, what are we doing here? We are trying to give awareness. What is it that you increase the productivity? So 1 rupee spent from a public health point of view will benefit in 23. So you have to catch the line. I was actually part of very recently with the Telangana government looking at gap assessment of healthcare facilities. We are looking at the community health centers, area hospitals. Everybody proudly says, we have iron sucrose injection. That's a last step. You are treating anemia. We should not be focusing on treatment, but the focus should be on prevention. Like simple things. I think that's again a learning from the projects we have had. Simple things. Just give chicky. Forget about IFA tablets. Give them awareness about chicky. What Dr. Santosh has been, I think, passionately working for the last couple of years. Breastfeeding. These are natural ways to sort of help mother and child nutrition. So there is a lot of work which actually has to be done. Let me also tell you, there are a lot of misconceptions. That's why public health becomes very important. It's not always the children part. When we did a study, we found that people said we will not do breastfeeding if we are COVID vaccinated, because we do vaccination and breastfeeding cannot go hand in hand. This type of misconceptions are also very much there in our society. Unless we have, and I think it should be a multi-pronged approach. Your academics, your NGOs, your policy makers, they all come together with this awareness. I think that's where we actually can move forward. I also want to sort of highlight that whatever we do here, there also should be a little bit of a documentation. So many people still are not aware. I think especially in Hyderabad areas it's good, but when you go to Adilabad, you go to Narumba, you go to Asifabad, I've seen tribal areas, their level of awareness, because I think organizations like Sushena and UNICEF work a lot on behavioral change communication. We need to communicate. It's not all about pamphlets and posters. You need to go and communicate to them. And communication to whom? It is not just only to the pregnant mother, to also to the family. So there are a lot of multi-pronged approaches are required. There should be a community engagement which is required. And I think that will actually help in mitigating. And this is, for me, is a long-term journey. This is not something, there's no solution. We were just discussing, I think there is also availability of drugs is an issue. So it's a health system issue which we are facing. But I think events like this, which will help give awareness, let's document that, and let us be warriors in that. Thank you very much.
I request Dr. Dhaatri to deliver the inaugural address.
This opportunity to talk about the nutritional aspect of children and mothers. So already Professor Millgro has delivered his entire gesture, అంటే జిస్ట్ అంతా కూడా చెప్పేశారు కదా. సో మాకు చెప్పడానికి ఏం మిగలేదు. But still, I just want to highlight a few points where say, అంటే మనం హెల్తీగా ఉంటే, మనము అంటే ఇక్కడ ఉన్న ఆడవాళ్ళు, అమ్మలు అందరూ కూడా మనం హెల్తీగా ఉంటే పిల్లలు, ఫ్యామిలీ మొత్తం హెల్తీగా ఉంటుంది. రైట్ అంత నీరసంగా చెప్పారు. ఇప్పుడే కదా రాగి మాట తాగి వచ్చారు. దట్ ఈస్ గివింగ్ లాట్ ఆఫ్ ఎనర్జీ కదా. So we as a mothers, we as women has to see what is the nutritional things we are giving to our children and the family. So మనం ఏం పెడుతున్నాము అన్నది. So there is a old saying, చాలా పాత saying ఉంది. వంట చేసేటప్పుడు అది ఏ భగవంతుడైనా సరే నామస్మరణ చేస్తే వంట అమృతం అవుతుంది అన్నారు. Here I am not talking about Rama, Krishna, Allah, Christ, whoever the God, the spiritual sense I am talking about. వంట చేసేటప్పుడు అమ్మ ఎప్పుడు కూడా పీస్ఫుల్, మైండ్ పీస్ఫుల్ గా ఉండాలి. ఎప్పుడు కూడా ఇది పీస్ఫుల్ గా ఉంటే మన పాజిటివ్ ఎనర్జీస్ అంతా వంటలో వెళ్తుంది. దాట్ విల్ గో టు అవర్ చిల్డ్రన్. సో నేను చెప్పేది ఏంటి అంటే ఈ ఉడుకులు పరుగులు యొక్క ఈ దీంట్లో మనము కొన్ని ప్రాచీన ఇవి మర్చిపోతున్నాము కదా. వీఆర్ నాట్ గివింగ్ దాట్ ఇంపార్టెంట్ టు ఫుడ్, వీఆర్ నాట్ గివింగ్ దాట్ ఇంపార్టెంట్ వాట్ వి ఈట్. సో మనం దాని మీద ఫోకస్ చేయలేకపోతున్నాం. సో ఇట్ ఈస్ ద రెస్పాన్సిబిలిటీ ఆఫ్ అ మదర్ టు గివ్ అ న్యూట్రిషనల్ ఫుడ్ టు ద ఫ్యామిలీ. ఉన్న దాంట్లో న్యూట్రిషనల్ ఫుడ్ ఇచ్చే బాధ్యత అమ్మదే. మనందరం ఇప్పుడు అమ్మలం, ఫ్యూచర్ అమ్మలం కదా. మేమందరం అమ్మలం, మీరందరూ ఫ్యూచర్ అమ్మలు. సో మీదే బాధ్యత టు గివ్ అ న్యూట్రిషనల్ ఫుడ్ టు యువర్ చిల్డ్రన్. సో మీరు ఫస్ట్ మీరు హెల్తీగా ఉంది. లెర్న్ వాట్ యూ హ్యావ్ టు గివ్ టు యువర్ చిల్డ్రన్. మీ ఒంటికి ఏది మంచిది అన్నది చాలా ఈజీగా అయిపోతుందని ఫ్రోజన్ వెజిటేబుల్స్ తీసుకొచ్చి వండేస్తున్నాము, లేకపోతే ఇన్స్టెంట్ ఫుడ్స్ తీసుకొచ్చి వండేస్తున్నాము. సో దిస్ ఈస్ ఆల్ నాట్ గుడ్. జంక్ ఫుడ్ ఇట్ ఈస్ నాట్ గుడ్. టేస్ట్ గుడ్, టేస్ట్ బడ్స్ ఒక్కసారి బాగుంటుంది కానీ ఇట్ ఈస్ నాట్ గుడ్ ఫర్ అవర్ హెల్త్. సో నెక్స్ట్ వీ విల్ ఫాల్ ఇన్ టు ఒబెసిటీ, తర్వాత షుగర్, డయాబెటిక్, నాట్ ఇవన్నీ అవుతుంది. సో హడావిడి లేకుండా కొంచెం పెద్దరాడే లేచి, కొంచెం పెద్దరాడే యూ వేకప్ ఎర్లీ, do your yoga, walking, whatever it is, cook peacefully, you cook food, keep it on the dining table, let children eat good food. So this is a small thing I wanted to add to the big event. Thank you very much for giving me this wonderful opportunity. Thank you.
Thank you for the response. I'd like to request Dr. Dhaatri to deliver the inaugural address.
Hello, good morning everyone, and I'm extremely thankful to Sushena Foundation. I think as we have more and more years of working in our respective fields, we will start craving for this presence of an audience like we have today. The opportunity to address the future citizens, the future policymakers, and the future management professionals of the country. And given this opportunity, at least one thing that I would request all of you, from whichever professional backgrounds that you hail, I am given to understand that we have medical students, we have nursing students, and we have nutrition graduates and postgraduates as well. Whatever you hear from the various people who have come in, identify that one action that you can do for yourself, and that one action that you are able to multiply in the society, so that you you are able to get benefited out of it, and also provide the benefit of that as you move around, playing the key role of a citizen and a professional as you operate in the environment, in your and create an enabling environment for other people also to grow and develop. So, as we're here to celebrate the World Food Day, I think there is a lot of things that experts have already mentioned in some detail, and we do have sessions which will outline some of these things. I would leave you all with perhaps 3 sets of things that one should go back and read more about. One is something that has come out early in this week, which is the Global Hunger Report 2025. Wherein we see that while India has made some progress globally and also in the South Asian region, we continue to remain in that severe deprivation zone. Now, when we say global food index, we don't translate it literally into how many people are hungry in the country. This index is divided into multiple indicators, and some of which Dr. Subodh mentioned. It is indicators around mortality, these are indicators around malnutrition, these are indicators around availability of adequate food for all age groups, not just children but also women, also adolescents, also adults. And when we look at this as a composite score, we don't see ourselves faring as well, or there is a disconnect. We are the country which has a very significant improvement in GDP. We are the fourth. We stand fourth when it comes to the biggest economies of the world, right? And when we look at these other indicators, we identify ourselves somewhere towards the far end. And so to understand this better, we came up with another index, which is called Multi-Dimensional Poverty Index, for which also you have, I think, data available from the year 2023, which also looks at some of these complex indicators brought in together. A large section of it revolves around child mortality or child malnutrition related indicators, wherein we have seen some progress, not a huge progress, but we've seen some progress, and we're on the trend of moving forward. And then there is another data set that becomes available to us every year, and this is human consumption data that Government of India publishes. And this is a very interesting report when you look at it. It talks about where are people spending more and more money. So the basic hypothesis that we look at is that as a country develops economically, the expenditure of the population reduces on basics like cereals, and their expenditure on things like protein rich diet, which could be pulses, which could be milk and milk products, which could be eggs and flesh foods, increases. But very interestingly, what has happened for India, or let me just speak for Telangana for a moment, over the last few years, we're seeing a huge trend of declining income contributed to purchase of cereals. But can you guess what are we purchasing more and more now? Any guesses? Packaged food, yes. There's about a 25% increase in purchase and consumption of packaged food. So does this now reflect that we are developed and we have more money to spend? And will this have an impact on our global hunger index or multidimensional poverty? How do you think as professionals we may fare on these other two indicators? If we are declining our purchases on essentials like rice and wheat and millets, but we are increasing our purchase on purchased goods, packaged food, ultra processed food, or food which are very high in fat, sugar, and salt, which also called as HFSS in the lingo. So while we have more money, we may have more education also, but the direction in which we are moving may really not contribute to improving our status in either multi-dimensional poverty index or in global food index. And this is something to think about, especially after having a very nice breakfast here. And what stops us from doing that every day? And I would leave you all to think about something and hand it back to our organizers. Thank you very much.
Thank you, Doctor. I invite Dr. Sushi to present her opening remarks. Thank you.
Good morning and a warm welcome to everyone. Doctor, really an honor to be here as part of NurtureCon 2025, and thank you, Dr. Santosh and the organizing team to have this together. On the e-words World Food Day, what better conference than NurtureCon 2025 to be happening? As we have just heard our earlier speakers, everything starts from that child, or I always talk as a clinical nutritionist, it starts much before conception. So, we talking about nutrition of the mother, and much before she is a mother, the woman, is, I feel, the most apt way to celebrate this week. So let's move ahead with all the topics that's laid down to us so that we delve more into the aspect of nurturing the woman of this world, I would say. Thank you.
Thank you, ma'am. Can we have a big round of applause for all our speakers and the inaugural session? I really want to hear that there is some ragi in all of our veins. Big round of applause. Okay, much better. Thank you. And to wrap up the inaugural session, I'd now like to invite the founder of Sushena Health Foundation and the founder of so many initiatives, including NurtureCon, which is, you can say, like a small child of LambCon. So that is also a mother and child, LambCon and NurtureCon. So without further ado, please welcome Dr. Santosh.
Thank you, Krishna. First of all, a big round of applause for all the youngsters who are in the hall. So much of youth energy that we can see here, and all smiling faces. Morning, when we came here, we thought of having some chai coffee, and then we were told by the organizers. So you can understand how much I'm into organizing. Though Krishna says NurtureCon is my baby, and I asked him for chai and coffee, and he said, "Sir, there is ragi, no chai, coffee." So big round of applause for especially Millgro for putting this together, and Krishna, Kamakshiji, and all the team members, Mallikarjun and everyone. Very healthy morning we had, like Dr. Kathy was saying, So you can see the breakfast and understand how important each of these fast foods that we eat outside. Even the Bombay Rava Upma is so minutely ground, it is not healthy. And today what we had, the millet upma and the beetroot chutney, and I still I'm able to remember the taste. Taste is something which goes into our memory. And what Ratnavali was saying, I asked her how is the taste, and she said it's tangy. It's like the allam and everything put together. It's a mix of so many tastes. She used the word tangy. So even if you do an upma with a millet and have a nice ragi juice, it can be as tasty as what it was today. So big round of applause. And I think in all of our conferences, especially in our medical conferences and all those doctor conferences, Dr. Banu, we eat only paneer, 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 aloo, aloo, aloo. Aloo khao, bhalu ban jao. So, and I was reading some article, 84% of our Indian paneer is contaminated. 84%. For those 140 crore people requiring paneer, how many cows and buffaloes do we require? And our cattle are decreasing in number. The ratio which we had when we were independent India and now, I think the ratio has decreased 16-fold, humans to cattle. So I think it is very, very important what kind of food we have. And I always keep remembering the famous saying by William Osler. He says, food is thy first medicine. So there's no other medicine bigger than food. And we are what we eat. I still remember, you all also might have this wonderful, how many of you buy XYZPQRS curd from outside? Curd, which is nowadays very fashionably called yogurt. Not just yogurt, Greek yogurt. As if India never had yogurt, Greek yogurt. And you go to any shop. But anyway, how many of you have curds which are done at home? Can you put up your hands? आपके घर में दही बनता है क्या? हाँ या ना? పెరుగు ఇంట్లో అవుతుందా? అసలు చేతులు గట్టిగా పెట్టండి పైకి. Wonderful, big round of applause. So don't outsource your kitchen. We have to ensure that we don't outsource our kitchen, and I think that's what Dr. Kathy was saying. The moment we have outsourced our kitchen to fast foods, and we have some 100 apps now, Zip, Zap, Zoom, Zap, Zepto, this, that, I don't know how many apps. Any app is going to say that we are going to bring anything in just a wink of an eye. We'll get you. Previously, you go to anyone's home, they used to give you majjiga, more in Tamil, majjiga, buttermilk, full of probiotics. Now you go to anyone's home, you get poison. What is that? Coca-Cola, Campa-Cola, this cola, that cola, or else most sugary drink that will ensure that you get a spike. Yesterday, one of our employees who's just 26 years old, who worked in army, his blood sugars are 307. Random. And why? Because of what Dr. Kathy was saying. So much of processed food that we are having. So we are at crossroads. Westernization, modernization versus what is needed for a human body. Human body has evolved from this nature, and it took 1 million years to build a Homo sapien. What it requires, how the pancreas was built, how the liver is built to process foods, is exactly the way it was 1 million or so many years back. And in last 50 years, we have changed the food so fast that none of our organs can take it. Neither the liver, nor the pancreas, nor the heart, nor the veins, nor the hormones, nor your metabolism. none of it can take it. So I think it's very, very important to understand organic evolution, and we live with the nature. The second point that I would like to dwell upon, and today we are going to talk a lot about it in our next sessions, is the dilemma we are in. On one side, there is a huge anemia, and on the other side, there is huge obesity. So, both the things, especially in India. India as a culture has its own values. Oh, this is better? Thank you. India as a culture has its own values. We were never used to jogging in the morning, jogging or running in the evening. We used to go to a river, get our water, do our agriculture and come back. So jogging was not a part of our culture. We are not hardwired for it. We are primarily agrarian society. So now hardwiring people requires a lot of change. A lot of nurturing is required. So both nutrition wise and this wise. Because of the behavioral change, communication and advertisements and so much of market driven economy, foods are changing, but other habits are not changing. So again, it is a very, very difficult situation that we are in, both anemia versus obesity war. We are at war literally. I want to tell you that in the state of Telangana, NFHS 5 data says that 23% of our population is diabetic, above 15 years. And 26% of our population above 15 is hypertensive. So imagine the burden of disease that we have. So I think today we are going to talk a lot about all these things and how we can address these aspects. We have a wonderful team of speakers, and I'm sure you'll have a great day today, especially looking at people who are from UNICEF, people from the organic farming sector, on what kind of foods to produce from ICRISAC, and from various farming sector organizations who are working on a lot of natural farming, but also from clinicians like Dr. Lata Shashi from Fernandez, and neonatologists and pediatricians, and so all doctors. So I think it's a very, very right mix of people for NurtureCon. And of course, Dr. Subodh, people like Dr. Subodh from Administrative Staff College of India, who have been working on these things in research and implementation. And so we have a very, very good mix of people. Lastly, I would like to also say that the kind of mix of participants today we have in this conference/workshop is very, very nice. We have a mix of, I heard BSc, MSc nutritionists, MBBS students, MBBS doctors, we have staff nurses, and we also have PhD students, and people who have done PhD, and a few BNYS and BMS. So it's a very good mix of participants. I would suggest that each of you introduce to each other. I know some of them have come from Mysore, and a lot of other people from other places have joined us. So I think it will be good that if you interact with the faculty, with the speakers, and I'm sure each of you can lead in future a very large organization. Probably one of you might lead NIM tomorrow. Some of you might lead large hospitals like Fernandez. Who knows? You will be working with Dr. Lata Shashi or someone with Dr. Kathy in UNICEF with the nutrition wing. So take advantage and try to interact, ask questions. And I think this is a day where we can learn more about maternal and newborn and infant nutrition. So kudos to the organizers and also to the faculty and to the participants, all of you. Yeah, before I head out, just one thing. Can we all say one of the most natural foods that in this world, and natural, no other love is bigger than this. So let's all say breastfeeding is best feeding. Can we all say it together? Breastfeeding. Oh, louder, Ragi, the Ragi power, iron and jaggery. Come on. Breastfeeding. Breastfeeding. Thank you.